Good. Well, good morning, everybody. Thank you. I'd like to go straight in and talk about mosquitoes. So mosquitoes. Mosquitoes are actually the world's most dangerous animal. Mosquitoes kill more people than humans do, and my goodness, we tend to kill a lot. In history, they've killed more people than plague or any other form of disease. Now, in the world, there are about 3,500 species of mosquito. In the States, you've got about 200 species of mosquito. And the one that is damaging, the one you need to watch out for, is called Aedes aegypti, one species which is going to cause a huge problem here in the States and in the US territories. It's called Aedes aegypti quite literally because it came out of Egypt, and it was spread by mankind in cars and planes around the world. And it spreads a variety of different diseases. It lives in and around your home. This is not a mosquito that you will be bitten by if you go out hiking or camping. This is a mosquito you're bitten by if you're in your backyard or you're sitting in a restaurant. It's an urban dweller. It bites only humans. It lives in and around your home. It doesn't fly very far. And it's pretty much everywhere in the world. If you take a line from sort of Washington and you take a line from Buenos Aires and you go around the entire world. It's the most remarkably adaptive and efficient and dangerous mosquito. Now, it is the primary vector around the world of dengue fever, which I'm sure you've heard of chikungunya, and now of Zika virus. Now, Zika virus is not new. It's new here, but actually it was discovered in about 1949 in Uganda. The virus was then moved over to the Far East, to Micronesia, Polynesia, and earlier last year it turned up in Brazil. And originally people thought this was another fairly innocuous flu-like virus spread by mosquitoes. And then the link with children's disorders, microcephaly, the link with paralysis, the Guillain-Barré syndrome, started to become evident. So this is now a really very serious threat indeed. And to see these small children, which are born with malformed heads and reduced life expectancy, very poor quality of life, is absolutely heartbreaking. This is a risk map I found the other day of the US. And basically what you've got here is just an analysis of what the exposure is. Now the colors, the darker shade, refers to where this mosquito naturally now resides in the States. It's an invasive species. It shouldn't be here. It was brought in, and now it's colonized all the southern and eastern area, as you can see. This mosquito is here and now. You only need to get one traveler coming into the area with Zika in their blood, and then the mosquito that's already here will transmit it. The size of the bubbles there, that is actually the number of travelers coming in. So if you combine the number of travelers coming into the state together with the level of mosquitoes you've got already, then you have a risk profile, which is really quite significant, with the main risk area coming up this summer, in these summer months. So the status in the US at the moment, thankfully, in the US mainland so far, as we've been through the winter months, when the mosquitoes are low, the rain is low, we've only really had people coming back from abroad from holiday with Zika showing symptoms. And of those, a small number of people who have been pregnant, who of course are one of the highest risk groups. When you go to the territories, when you go to Puerto Rico or the Virgin Islands, then obviously the number's much higher. So in Puerto Rico already there's been 500 cases of locally acquired Zika, where you've got the mosquito, someone's come back traveling, and then of course the virus is now spreading. And there are some very, very scary assumptions out there which don't come from us, come from CDC, or where people are talking about potentially hundreds of thousands of cases. So traditionally, how do we control mosquitoes? I think we all understand that. We all use insecticide sprays. We all cover our skin sometimes in DEET. But fundamentally, the way people have worked with mosquitoes is the same for the last certainly 70 years, which is using insecticides. Now, insecticides, you see here, this is a slightly graphic picture of a man fogging or putting insecticide into a classroom. But pretty much that's the state of the art around the whole world. You get better chemicals, you get people with face masks, you get better application. But it's the same idea. You're trying to put a chemical toxin into a space and control the flying mosquitoes. It will kill all insects, as long as they're not resistant, and many of them are. And the irony is that even in this child's classroom, if you had a flower pot there with a few mosquito eggs in, then the day after the man with the insecticides gone away, new mosquitoes could hatch out. So controlling mosquitoes with insecticides is not a bad idea in a small space, but you really can't reduce your overall threat level using insecticides. It's just not effective. The biggest area is private property. We all live in houses. We don't want government inspectors coming into our houses and our children's bedrooms, spraying and fogging everywhere. So because you can't get access in today's society to everybody's house every day, you actually can't control it. So I'm not expecting you to read this chart. Really what I wanted to say here is that as a UK company, we were set up in 2002. All our technology comes out of Oxford University. And actually, we started back in 2002 targeting this mosquito. We had no idea about Zika. We had no idea about chikungunya. But we did know about dengue, and we did know about the mosquito. So our simple philosophy was, well, if we can knock out the mosquito, then any disease it spreads, regardless of what it is going to go away. And if we can have less mosquitoes, we're going to have less disease. So very simple philosophy. So we've actually been working on this since 2002. The product I'm going to talk about, our approach, actually we developed in 2002. It hasn't changed. It's exactly the same. All we've done since 2002, actually I would say all we've done, probably not the right way expressing it, but what we've done since 2002 is actually test it, develop it, and bring that forward in a number of countries. From 2009, we've been testing this outdoors. So this is how it works. We take Aedes aegypti. This is the mosquito that bites you, that spreads disease. Interesting fact, it's only female mosquitoes that bite you. Males never bite. They can't bite. They don't have the mouthpieces. So every mosquito that's ever bitten you is a female. So what do? Well, we actually give all of our mosquitoes, we breed them, 2 additional genes. The first gene is what we call a self-limiting gene, which means when one of our mosquitoes mates with a wild one, all of the offspring will inherit one copy of this gene, and they all die. Very straightforward. So all of our mosquitoes carry these genes, all of the offspring inherit them, and they die. The second thing we put in there is we put in a little color, and what you can see in the top of the chart there is 4 mosquito larvae, of which 2 are ours, and they exhibit this red color. And what that does is it gives you like a track and trace. We can see where our mosquitoes go. We can see how effective they're being. We can calculate, we can predict, we can release more, we can release less. We have a way of actually seeing everywhere in the town how we're getting on and how we're controlling this population. If you look at an insecticide approach, you go down a street, you spray insecticides, you've really no idea what the outcome is. With us, it's all metric driven because we have this color. So quite literally, we will go down the street, we will release male mosquitoes because they don't bite, they don't spread disease. We'll put out the males. Males will do what males do very well, which is go and find the girls. They will go out and find the women, the female mosquitoes, they'll mate with them, and the offspring will die. And if we can put more males in the environment than are already there, the females will have more chance of mating with ours, and then you'll bring the population down. So that's the theory. Number of advantages. First is it works. We've done this in a number of places. Using a male mosquito to find a female mosquito is a lot more effective than using a human in a boiler suit armed with insecticide. The male will actually tune in to the female's wing beat, go out and find her. Secondly, we've got this track and trace, so we can actually fine-tune what we're doing. And from a safety point of view, we're releasing the male, which doesn't bite. The way in which the technology works is actually the offspring are prevented from developing properly. There's no toxin involved, there's no allergen involved, and we're only actually looking at controlling the one mosquito that's spreading disease. So here in the States, if you took all the mosquitoes in Orlando and you said how many of those were this one mosquito that's causing trouble, it's less than 1% in terms of the biomass. You knock that mosquito out, you make absolutely no change to the rest of the ecosystem, even though actually that mosquito shouldn't be here in the first place. And possibly the biggest advantage of all, which is a little bit counterintuitive sometimes, is our mosquitoes don't stay in the environment. Every male we release is going to die, and each of their offspring is going to die. Call it the self-limiting approach. This is a graph which, in the interest of time, I'll be very sort of swift in explanation. What you're seeing is a pattern over a year of mosquito numbers, comparing two areas, one in which is conventionally treated with insecticides, and one in which, that's the red one, and one in which is treated with our approach. And the red area, you're using normal insecticides. The big shift in numbers is really the rainy season. As you read across the graph, you're coming out of the rainy season into the dry season, mosquito numbers come down, and then they go up in the rainy season. Almost no difference from one month to another in terms of sporadic change, because use of insecticides in that area is very locally targeted, and if you look at the population as a whole, have very little impact. Whereas with our approach, the blue line, you're keeping the mosquito population down, you're reducing the threat to really trace levels. And if you look at what the trials we've done in various different countries actually, it's a very consistent result. So as I said, we've done this in various countries. In every single case, we've reduced the mosquito population by over 90%. Every single case, there hasn't been a single failure. And that's not surprising, because actually it's a numbers game. The more mosquitoes are out there, the more males will release, the faster we bring the population down. If we have more mosquitoes in a particular area, we just release more of ours. So it's a very consistent picture, and all these trials have been done through third parties. So looking at Brazil's a really interesting country, and it really is a sort of a case study in terms of how much damage these mosquitoes can cause. Now, in the mid-70s, the government of Brazil actually made quite a famous statement, which was, it said, "We do not have this mosquito in Brazil. We don't have it anywhere. We've got rid of it. It's not here. And we don't have any dengue cases or diseases from this mosquito, because we've done such a good job in the 1950s and 1960s. So we've got rid of it." And then, of course, the chemicals they were using were banned, and what's happened is the mosquitoes come back and colonize the entire country. So from a standing start of zero, in effect, they now have over 1.5 million cases of dengue every year. They've then had chikungunya come in, and now they have this total catastrophe called Zika. And the Zika crisis is growing all the time. It hasn't peaked by any stretch of the imagination. So we've started working in Brazil. We've gone in, we've done trials, we've got national approval. So we now have national approval. We can release our mosquitoes anywhere in the country in terms of the regulation. And from a commercial point of view, they've just given us special registration to bring this forward quicker, so we can help in the struggle against Zika. Here in Florida, there were some local cases of dengue fever in the Florida Keys, 2009, 2010. So following that, the Florida Keys Mosquito Control Board reached out to us and said, "Can we try your approach? We've read about it. We think we'd like to have a go, because no matter how good our team is, we can't control this mosquito, and we know if disease comes back, we've got a problem." So we've started to work with them. We started to work with them then, back in 2011. We filed a regulatory dossier with the FDA, and it's taken a long time, I would say that. But we're now in a position where the FDA themselves, in consultation as well with the EPA and CDC, have said, we've reached an opinion, and our opinion is there is no significant impact on health or environment of this mosquito from a negative point of view, so we think this is very safe. It's a preliminary opinion, because it now goes into it's in public comment now, and so at the end of public comment, then they'll make a final decision. But certainly that first decision is groundbreaking, really. So we're aiming to do a trial in the Florida Keys. Just before I come back to the Keys, from an international perspective, how does this look? Well, really, this mosquito is the same around the entire country, entire world, sorry. And we've been concentrating very much on the Americas. We now have, as I said, Brazil national approval. We have the FDA here in the States with their opinion. We've also got two major institutions. The first is the World Health Organization, which almost never recommends a product, ever. It might say insecticides of this class are useful, but in our case, they've actually said, do you know what? Because we have this international emergency with Zika, we actually recommend the Oxitec product is used by countries in a step-by-step manner, using all the normal precautions and sort of systematic development, but we're actually recommending that this is done. And then the Pan American Health Organization has said, well, from our part, what we'll do is if any country wants to avail themselves of this technology, we'll help them with whatever technical support we can give. So that's a huge boost to the efforts that we're carrying out. From a consumer point of view, this is a really interesting paradigm, really. This is genetic engineering, but it's completely, or genetic modification, but it's completely different to the genetic modification that people expect. And what we've found is, actually, if you go down into the street, if you talk to people, they are very supportive. So in Brazil, where we're using this, we have 96% support in Piracicaba, which is our first major project. 96% support for a public health initiative, which is, regardless of what initiative, that is a huge statistic. And here in the States, in the Florida Keys, there's been a number of studies over the last 5 years while the regulatory process has been going on. And they've been very consistent as well, which is you have about 60% very positive support, about 30% neutral, and then you get a small number of people, about 6 or 7%, who will say, look, genetic engineering, no thanks. But very much the minority. Now, once Zika comes in, or in the sort of post-Zika world, I saw a study from Purdue University the other day, which said in a specific survey they did, 78% support the use of these mosquitoes to try and combat Zika. So you really do get a very strong public support. And what we do is we take our message into the street. We obviously will do communication in this sort of forum, in stakeholder meetings, in scientific conferences, but we also just go into the street, talk to people, we'll set up tents. We have quite a neat system, which is we have a cage of our mosquitoes, and we send out males, and males don't bite. So you can put your hand in the cage, and you're not bitten, and that transmits a very clear message. And in places like Brazil, that's very effective. So it's very much it's a boots on the ground communication exercise. Here is Brazil. This is what it actually looks like in practice. That is a factory. It produces millions of male mosquitoes a week. The lady in the top right, what she's got there is little pots of pupae. Male pupae, they'll go into little pots, they'll close out into males. Those males will then get put in their pots into trays. The trays get put into a van. The van goes down the street. There's someone in the back of the van with an iPad and a GPS linked system. And whenever we go over a GPS point, someone puts a pot of mosquitoes out the window. And that's what you see. If you're standing in the street, what you see is a little Oxitec van. Every now and then, you'll see a little puff of about 1,000 male mosquitoes come out, and they dissipate, and off they go. And you really don't notice them because, from that point on, because there are so few of actually this species compared to all the species of mosquitoes that are out there, that they go off and do their job. And that's what you see. Looking about how this will work on a sort of global basis, it's all very well doing small little trials, but we want to protect millions of people. So it's very similar to anything else, really. These mosquitoes, they produce eggs which are very durable, and it's partly why they're so successful in spreading around the world. So we aim to have 3 or more big factories where we supply mosquito eggs. We're the one in the bottom left, that big building, we're building that at the moment in Brazil. So we can send the eggs, literally, through the post. If I had a coffee cup, that would hold about 5 million mosquito eggs. So logistics is probably not our biggest problem. So we'll send those mosquito eggs to smaller little facilities like the one we have in Brazil, where the eggs are hatched out and then released around town. And we've even got a little mini factory. That container in the top picture is a mini mosquito factory, and that's designed if you wanted to do a small little implementation on a Caribbean island, for example, and you didn't want to build a factory, you just send one. It doesn't look very pretty, but it's enormously effective. So just to sort of summarize, really, this is a system that's been going for a few years now, and it's been tested. It's new, but it's not new for us. We've been at it since 2002. Highly effective, now with institutional support. And in the US, to go back in time, when we worked with the FDA, what the FDA said to us is, don't give us 3 or 4 trials, give us 1, because then we'll actually help get you through the system, because this is a brand new product, brand new regulatory system. We need to bring a lot of people in to examine this. So we ended up with just 1 application for 1 trial, which is going to take place down in the Keys. And that process has now been rolling on. But it does mean, in effect, that the trial that is the gateway for the whole of the US to bring this forward is actually in 1 location. And if that trial didn't go ahead, then the whole process gets delayed. So that we're now in a public comment period. There are people out there that don't like genetic engineering, and I completely respect that. But I also respect the people that will see the science, that will listen to the arguments, and that want to protect people. So we're in a public comment period, and everyone is invited to put their comment in, for or against, or just with a comment. And really, my big ask to you today is please put a comment in, because if you don't put a comment in, the only people who put a comment in are those people who tend to be sort of emotionally involved and negative. So we've actually put a portal up called stopthemosquito.com. So if you'd like to click on that, put a comment of any kind, I'd be really appreciated. And then what the FDA will get is a balanced portfolio of comments coming from a wider range of people. So with that, thank you very much. I'm delighted to answer any questions either now or later on.
Does anyone have any questions? While some of you are thinking about another question, I'll kick one off. So you talked just a little bit about the comment period that is open right now. How, maybe a little more specifically, how can companies or individuals get engaged? I saw the slide with the stopthemosquito.com. I think you have social media active on that as well. Yep. Talk a little bit about, could companies write a letter to the FDA and that comment process, and I think really just the importance of the timing and how, if this doesn't go through, it's such a lengthy delay.
Yeah, so it's a bit of a function of the FDA process, but the FDA process starts with a question: where are you going to do your trial? And from there, everything starts by being site-specific. So you have to actually nominate the trial area right at the beginning. So the Florida Keys Mosquito Control District have nominated their area, which will be Key Haven in the Keys. The public comment period now, therefore, is now open, and you can comment up until the 13th of May. There are 2 ways to do it. Either you can just Google FDA mosquito, and you'll find the page very quickly, or you can go to just this portal we've set up called stopthemosquito.com, and then you just tap on that, and you go straight to an area where you can put a comment in, and then that goes to the FDA. And really, you can comment on any aspect you like. You can comment on the safety, you can comment on regulation, you can comment on us, the need for new approaches, the importance of Zika, anything you like. It's completely open. But it really is critically important, because there will be 2 levels of go-ahead, really. What we'll find is that the FDA will give their scientific evaluation, and then secondly, there'll be a decision in the Keys which says, do we want to go ahead, here in this street? And if they do, that's terrific. Then we're off and running, and then we can bring this more widely into the whole of the States. If that decision ends up being, well, actually, no, why don't we do it somewhere else, then actually you could get a year or 2 years delay. And I think the issue with Zika is one doesn't have 1 or 2 years delay. Our approach is a preventative one. And what we're doing is knocking out the mosquitoes that actually spread the virus. And you need to have, if you have the mosquito there, you can get transmission. And at the moment, this is a potential threat in the US, a very real danger and problem in Puerto Rico at the moment. But we need to have new tools. And at the moment, the only tools we've got are insecticides. And they don't work, not in an urban environment, not in a town, not in a city. In effect, an insecticide is a little bit like my hand. I can squash a mosquito as long as I can hit it with my hand, and I can kill a mosquito as if I can hit it with a chemical. But I can't control, a population. If this whole, if you imagine this hotel, if this hotel contained 5 female Aedes aegypti, and I send any of you out with a bug spray and ask you to go and kill those 5, you won't find them. Release 5 males, and they'll be there in an instant. So this is a much more targeted and effective way of going about it. So I'd really appreciate your support. Thank you.
Any other questions? Okay. Thank you. Join me in thanking Mr. Parry for being here.
Thank you very much.